Super excited and opening up this box with my new book, Health Promotion Moving Forward, a Population Health Approach. Hi, my name is Jody Gan, and I'm a professor in the Department of Health Studies at American University and the author of Health Promotion Moving Forward, a Population Health Approach. And I wrote this book for three reasons. For too long, health promotion has been a field where our work has been targeted at individuals, what they should and should not do to live a long and healthy life. Don't smoke, eat more vegetables, get more exercise. I wanted for my students to have a book that would examine important health behaviors beyond about what we eat and how much we move, but one that would also consider pressing threats like food insecurity, all the new flavored tobacco products that are threatening the progress of the decline in cigarette smoking. I wanted a book that would focus on the loneliness epidemic, the opioid crisis, and the many barriers affecting our sexual health. I wanted a book that illustrates strategies that target not just individuals, but the environments where they live, work, play, pray, and age. This involves the hard work of building healthy communities where the healthy choice is the easier choice and for everyone. Using a socio-ecological framework, the book spotlights novel interventions at the interpersonal, organizational, community, and societal levels that are so impactful in influencing an individual's behavior. To me, this illustrates a population health approach. Probably, though, the most important reason why I wrote the book is that during the pandemic, all I kept thinking about is that public health textbooks would have to be rewritten. I wanted to capture not only the lessons learned from the pandemic regarding all the things that went wrong, but also highlighting all the innovations that will be key for health promotion moving forward. School bus drivers delivering food to kids at home who relied on that school lunch that they were getting, barbers encouraging their clients to get vaccinated, and mass vaccination clinics at places like Six Flags and Dodgers Stadium. Post pandemic, we can talk more openly about loneliness and mental health, and we can get help from telemedicine when we need it. So these are the three big reasons why I wrote Health Promotion Moving Forward.